I'm Dr. Matthew Schulman, board certified plastic surgeon, and today let's talk about lips. Specifically, how do you get fuller, plumper, pouty, kissable lips? Well, traditionally, we've done it with injections, fillers. So products like this, where I actually have to inject it into your lip. So I'll take the needle and actually inject you. It works really well. It's a good way to plump up the lips, reshape things, fill in the lip lines, all sorts of things. The downside is it's temporary. So temporary fillers such as Restylane or Juvederm can last for about 6 months in the lips. So it's a type of thing where people will come back in every 6 months to redo those injections. Now that may be a great solution for you, but it may not be for everyone because it's a little painful and it can get expensive if you start to add that up over time. So what are our other options? So there actually is a great option for people who want, for whatever reason, an alternative to temporary lip fillers, and that is permanent lip implants. So there actually are implants for the lips. They're made of silicone, but it's not a silicone like you would get in a breast implant. It's actually silicone rubber, so it's solid silicone, almost like a gummy worm or a worm that you use for fishing. In fact, here it is. This is the actual implant. So here it is. This is a silicone rubber. You see it's very flexible. And also watch when I stretch it. It really is like a gummy worm, but this inside the lip will give you nice fullness, but also the flexibility to move when you move your lips. So these implants come in a variety of sizes. They come in essentially a small, a medium, and a large in terms of thickness, so you can get the fullness you want. They also come in different lengths, basically a small, medium, large, so that they can be customized to your mouth. Some people have short lips, some people have longer lips, so you basically have 9 different implant options in order to give you the look that you want. So how is it done? It's basically done under local anesthesia right here in my procedure room. What I do is I numb up your mouth. I do it with a series of little injections to numb things up, combined with some numbing cream, and then I make a small incision in the corner of your mouth. Once that incision is made, I make a pocket in the lip so that this implant can slip right in. I can put the implant in the top, I can put it in the bottom, I could put it in both. And because we can give you the look that you want, sometimes I'll use different sizes in the top and bottom. Maybe you want your upper lip to be fuller than your bottom lip, or maybe you want it the other way around. You want to have that pouty appearance where the lower lip is larger than the upper lip. We can do that. The procedure itself takes about 45 minutes. Afterwards, there'll be some small stitches in the corner of your mouth that will just dissolve on their own. Usually my patients will say that they spit out what they think is a hair after about 4 or 5 days, and that's it. There is a recovery to this procedure, just like with any procedure. You will definitely be bruised and you will definitely be swollen, but the advantage of this procedure over temporary lip fillers is you really only have to go through this once. The worst of it seems to be for the first 4 or 5 days, and that's just because you're swollen. I want you to be careful when you're eating because I don't want you to open your mouth really wide because you may stretch those little incisions that are in the corners of your mouth. So you have to be careful. Almost like during winter when you have a little bit of a cut from chapped lips in the corner of your mouth and it hurts to open your mouth real wide. That's kind of what you're going to experience. But after about a week, things are looking much better. But it may take a few weeks before things settle down and look as good as you want it to look. The great thing though is, like I said, you only have to do this once. And once the implants are in and you're happy with them, you never have to do anything with them again. As you can see, you can get really nice results with lip implants. They can look natural. They don't look like anyone has an implant. The implant is done in a way where you're gonna notice there's an implant in there, but other people, your partners, won't notice that they're implants. It would be unfair for me to tell you that there are not people out there who really hate the fact that we put implants in the lips. I get it. There are definitely criticisms of implants, but what you have to keep in mind is these were based on implants from many, many, many years ago. The old implants that people used to use for the lips were frankly terrible. They were made of material that was too stiff, material that didn't move when your lips moved. They gave a very unnatural appearance to the lips, specifically because the implants kind of were full, just as full on the ends as they were in the middle. So it gave this tubular structure to the lips. It was really unnatural. And the worst part about the old implants were, if you wanted to get them out, you just wanted them removed for whatever reason, they were really hard to remove because they got stuck in to your tissue. So there was a lot of scarring and things like that that happened, so that when you remove those implants, they could deform your lips. But these are the old implants. The implants we use now are very, very different. So here are the new implants. And remember, I showed you this. They're soft, they're flexible, so that when they're in your lip, they're gonna move and feel natural. When you have lip implants, you're obviously gonna know you have an implant because it's your body. But other people won't know, your partners won't know, they won't see it, they won't feel it. That's the beauty of these implants. The other thing is, notice on the ends, see how the ends are tapered, they come down to a point? That helps prevent that fullness out here, that like tubular appearance that we used to get with old implants. So again, they look more natural, they feel more natural, and the best part, if you wanted to take them out, you can just take them out. It's smooth, it's a smooth silicone rubber, so it doesn't get stuck into the tissue of your lips. So for whatever reason, if you wanted them removed, we can just pull them right out. It won't cause any deformity to your lips, and it won't cause any destruction of the normal tissues. So that's a huge advantage over the old implants. So yes, I get it. Old implants were terrible. These are new implants, and they have a lot of the advantages of an implant that we wanted and eliminate all those disadvantages of implants we used to use 10, 20 years ago. So here they are, permanent lip implants. It may not be the best thing for you, but if you think it is, if it's something you want to explore, then reach out. Make sure you find a plastic surgeon or a facial plastic surgeon that is very comfortable doing lip implants, because this is not a very commonly done procedure. So if it's something you want to learn more about, check out my website, reach out to us, and we can make that appointment. And of course, if you like videos like this, don't forget to like, comment, and subscribe to my channel.